primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is an amazing vehicle for me to bring to patients the great medicine I always dreamed of doing. What I didn't see coming was what great medicine they were going to end up being for me.
Direct primary care has saved my professional soul by giving me ownership, quite literally, to practice primary care the right way. I've felt empowered by direct primary care to care for my patients and also to care for myself and my family. I truly believe that direct primary care is an accessible, affordable, sustainable, and high-quality solution to primary care in our country.
I'm Dr. Corey Annis.
And I am Dr. Amy Nayo.
We are Unorthodoc.
And this is our DPC story.
In 2015, Dr. Corey Annis opened Unorthodoc in Carborough, North Carolina, after many years in the traditional insurance-based model. She experienced the mounting barriers that middlemen created for primary care and knew there had to be a better way. She envisioned a practice that gave her patients what she felt they deserved: affordable, relationship-driven primary health care without the constraints of profit-seeking third parties. Dr. Annis is double board certified in internal medicine and pediatrics and enjoys hiking, dancing, and spoiling her dogs, her beloved Caden and their 2 spaniels. Dr. Amy Nayo is a family medicine physician. After obtaining an undergraduate degree in the history and philosophy of science, where she thought big picture about theories of knowledge, Dr. Nayo traveled to Togo, West Africa, to serve as a Peace Corps volunteer. While working with an association of people living with HIV and AIDS in Togo, she found a spark for medicine. She returned to the U.S. to work, marry, start her family, and several years later, matriculated into medical school at the University of North Carolina at Chapel Hill School of Medicine. She chose family medicine because she believes in the power of relationships and preventative care, and initially worked in a rural community's fee-for-service practice doing broad-spectrum inpatient and outpatient care. She transitioned to direct primary care in 2020 when she joined Unorthodoc Direct Primary Care, initially as a general contractor. As of 2023, she is proud to be co-owner of Unorthodoc and loves practicing in the direct primary care model. Thank you so much, everyone, for tuning in. Find more about DPC, including resources, discounts, my favorite tech tools, books, and more at mydpcstory.com. The mapper has been updated so you can look for practices by specialty. Follow us on your social platforms at our social handle at mydpcstory, and be sure to subscribe to our newsletter and, of course, the podcast feed so you won't miss when the next episode drops. If you're new to the podcast, check out the blog accompanying this episode, also at mydpcstory.com. So with that, I'd like to welcome our guests. Welcome to the podcast, Dr. Annis and Dr. Nayo.
Hi, we're happy to be here.
I am so excited. As I shared before we hit the record button, you guys are doing this together. I love that even in your opening statement, you said we are Unorthodoc. And I think that that is so important for people to see. There have been partnerships highlighted on the podcast before, but not enough. And so I think that it is wonderful that you guys are here, and I'm so excited to hear your story. So Dr. Annis, I want to start with you because back in 2015, you opened a DPC in a world where there were not a lot of DPCs. That's almost 10 years ago at the time of this recording. So I wanted to really hear from you what was going on before 2015 that made you even think there has to be a different and a better way to practice medicine.
Oh my God. That is a huge question. Well, direct primary care actually didn't have a name when I started putting it together. I heard on your podcast, Garrison Bliss, say something about maybe the first time the term was used was in 2009-ish. And in 2010 is when I started thinking, I had a conversation with an entrepreneur patient of mine who wasn't coming in for his visits. And I said, you have got to come back in 3 months. And he said, I'm going to be in Singapore. Can I just Skype you? And I said, no. He said, why not? I said, well, because Skype isn't HIPAA compliant. Okay, we'll use FaceTime then. That's fine. And I will FaceTime you. And I said, well, no, we still can't do that. Your insurance won't pay me for it. And he said, oh, but I will. And I was like, I mean, I remember this. I remember the moment clearly, because it was like, you would value my time. You would pay me. And he said, yeah, as an entrepreneur, I lose a lot of money when I get up from my desk and drive over here to your office and sit and wait and then do the thing and go and then reverse my steps. It would save me so much time and money if you would just come to me. So he sowed a seed. I said, are there any more like you out there? And he sowed a seed that I started thinking, wow, there are a lot of people, particularly small business owners, who need somebody who's more flexible, who can need somebody who can give them care that's more flexible than what we've got available right now. And I realized this guy had highlighted a really important problem for what he was doing. So I started thinking about doing this for entrepreneurs initially. I was initially the MD for entrepreneurs. But as I started following this guy around the globe, I realized that actually his wife with 4 kids at home needed me more than he did, because she had to get an emergency babysitter anytime a kid got sick. And from there, I just started tumbling over all of the things that I could do as a doctor if I wasn't having to follow insurance dictates of the person has to come in and be under your roof for you to get paid. Oh, well, if we take that away, what I can do and how I can deliver service becomes unlimited. And I knew you were probably going to ask me where we came up with the name Unorthodoc, but I don't know. I was in the shower. And I trademarked it because the first TED Med I went to, somebody actually said, Unorthodoc, oh, we need that for our new endeavor. I'm going to steal that. And so I came home and called a trademark lawyer and decided that if the whole thing went belly up, I could at least sell the name.
And that's a gem, people, right there. If you have not, as the movement grows, there is real estate in buying domains. There is real estate in trademarking your name that you have worked so hard to be the brand behind. And so if you are listening and you have a name that is amazingly unique, like Unorthodoc, trademark that. It is worth the investment. I have done the same with Big Trees Health, which Big Trees MD runs under. And nobody can take that, because in the world of medicine, it is mine. And so I think that is such a empowering statement, an empowering gem for people to hear early on. We're not even in the first 5 minutes of the podcast. It's amazing. So let me ask you there, because when you were the physician for entrepreneurs and you were starting to do this, did you have any issues in breaking free from the system in terms of contractual obligations, in terms of how to handle the patient's care after you left from your previous place of practice? Were there any snafus that you experienced in going into direct care?
No, not really, because I owned the practice I was leaving. And so I'm kind of unique in your podcast physicians, just in that most of my practicing life I've worked for myself. And the building where Unorthodoc lives right now is on the corner of the building that me and my partners purchased together when we decided that our digs were too small and we needed some place for our independent practice. So it really worked out so nicely. I didn't feel the need to leave because it's my building. And so I just sort of gently transitioned into doing this with the blessing from my reigning partner at that time, who did not want to join me because she is a wonderful, incredible doctor. She likes to follow rules and I don't. And so, I don't like to follow rules that don't make sense. And we came to the veritable, if you think of partnership as a marriage, we came to the veritable point where we were having that discussion about kids versus no kids. So DPC versus fee for service was that conversation. And you asked me why I opened Unorthodoc. The final straw was something you don't see much in the systemic world, but it was a clawback. Our independent practice got a certified letter from a big insurance company who shall remain nameless, that the certified letter said you owe us $20,000 out of the blue. no argument, blah, 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 because we were apparently coding Pap smears wrong. We were coding them the way Medicare advised us. And we can go into the details don't matter so much as the day that we with all the appeals that we did, the day that we lost that, I called my accountant and said, please file the incorporation papers for Unorthodoc. And because, and this came up in my partnership discussion, my partner felt unsafe with the idea of just going out into the world and throwing ourselves on the mercy of our patients. And I at the time, I realized that I felt safer throwing myself on the mercy of patients I didn't even know yet, rather than remaining in a system where, without impunity, a big, deep-pocketed corporation could just walk up and say, hand me enough money to ruin your practice, and get away with it. So my safety, I felt much more confident in my ability to actually take good care of patients and make people happy, give people a great experience. I felt much more confident about that than I did wrangling the insurance system.
And I think you have more people in the audience now nodding their heads, especially after we experienced what happened during the pandemic and private practices closing left and right, and people not having access to care any longer because of things like this.
Yes.
They have continued and they've gotten worse. So now this is a perfect place now, Dr. Nayo, if you can share your story in that. I mean, you're coming from having a kid before you even started med school, and then you're choosing to do DPC after being a person who was in a rural community, doing inpatient, doing outpatient. What was it that you were experiencing that pushed you towards finding Dr. Annis and joining on at Unorthodoc?
I mean, I think so many family doctors who have practiced in the fee-for-service world, there were so many straws that broke the camel's back, probably too many, right? I worked for one of the last independent county health systems in North Carolina. I went there very intentionally. I thought being a family doctor in a rural community would allow me to practice broad spectrum medicine. And I thought working for a small system that I would have a voice and would be able to implement positive changes for the community. As a returned Peace Corps volunteer, I think I always wear my public health hat, right, of thinking about how I can serve populations as well as individuals. And suffice it to say, the system I worked for had no interest in my opinion. I mean, honestly, at the end, it was quite the opposite. One of the leadership at the county level said to me one day, "I'm surprised you have so many opinions." And I said to him, Are you speaking to me as a physician or as a woman? Because physicians, by definition, have opinions about their patients' care. I mean, it was all the things, right? It was the 15-minute appointments. It was the constantly being gaslit about requests for improving patient care. It was the workload. I was working on labor and delivery and doing inpatient pediatrics. So I was rounding in the morning, doing circumcisions, going to clinic, not seeing my family, being called into the hospital in the middle of the night, and then being treated like I was crazy when I asked for things like another MA because I was one of the most productive physicians in their system. It was a really sad day when I turned in my resignation because I love that community. I'll probably get emotional just talking about it. Wonderful patients who really need good doctors. So it was a hard decision, but 100% by the end was the right thing for me and honestly for those patients and for my family. So.
And how was it? Because right now you guys are looking for someone to join you at Unorthodoc, but how was it that you guys came to find each other?
I think I saw it. So
she was cyber stalking me.
Yeah, I was kind of looking at her practice a lot. So, I mean, the short story is that I found the direct primary care model. It really spoke to me. I knew I wanted to do it. The two barriers for me were, one was financial. My husband is a social worker, so we are reliant on my income, and I still have student debt. So that was an important barrier. And then the second barrier, in all honesty, was I love having a clinical and now business partner. I worked with a family doctor friend of mine in the rural independent system and really valued having someone to talk about clinical cases with, having someone to cover vacations for me. My husband's from West Africa. When we go on vacation, we really go on vacation, and I don't want to take any call. And so I was hesitant about the idea of going independent with direct primary care. Interestingly, though, a lot of physicians cite fear about the business part of direct primary care. That was not at all the obstacle for me. I knew I wanted to be involved in running a business, thinking about the business's future. So long story short, I took a night job at a prison to pay the bills because it didn't have a non-compete, and then realized I wanted someone who would partner with me to practice direct primary care. As we're going to talk about more, that can be a complicated thing, right? There were direct primary care practices in our area that were looking to hire an employed physician, but I was very clear that I wanted a pathway to partnership. So Corey posted a job ad. I think I saw it on Facebook, and I was like, I don't know her. I've never met her. She's a med peds doctor. I'm a family doctor. We're different generations. But what the heck? What's it going to hurt to talk to her? And the first time we talked, I got off the phone and my husband just said, "You look so jazzed and excited," because I felt like I had found someone who had such similar values to me.
Oh, that makes me emotional. That makes me emotional.
So I'm going to probably make you get out the Kleenex now, because I want to ask even more about that. Because Dr. Annis, when you were in this space of, I have a practice, it's been open since 2015, 5 years later, you're putting out an ad on Facebook. It must have also been scary to make sure that you found somebody who was in alignment with the way that you were delivering care to the community. So how did you go about intentionally finding someone and eventually finding Dr. Nayo to be that person who you were looking for, who you're advertising for?
Well, I tried to be very intentional about finding her, but I still think it was an act of divine intervention that it was her. Specifically, I couldn't have asked for better. And I'm going to get emotional talking about why I went looking for her. When I started Unorthodoc, I thought, this is it. I'm going to retire here, or they're going to find me dead at my desk with a smile on my face. That's all there was to it. But when I was actually in British Columbia, sitting at the bedside of my very dearest friend, my soul brother, who was dying from multiple system atrophy. And I thought to myself, if I were retired, I would be here with him until the end. And it struck me at that moment that I had no succession plan. That as much as I loved what I was doing, and I love what we do, as much as I loved what I was doing, there were a few things in my life that I loved even more, and I wanted to be there with them. And part of the reason I went towards Unorthodoc was to create greater freedom in my life. But as a single proprietor, I was lucky enough to be able to work out some things with my previous partners, because they would sort of watch the shop while I was gone. But I still didn't feel like I could leave for 2 weeks. I was very circumspect about the time I took off. And it was then that I thought, as a matter of fact, I saw this, I ran into this the other day when I was filing some old journals. It was on my way home on the plane, I wrote, "Find a partner," at the top of my to-do list. And so I thought about it a bit, and then I put the ad out, and I put it only on Facebook and Instagram. And I thought, Instagram, for me, I'm 67. Advertising on Instagram just seemed, so naughty and so bold, in 2020. And I thought that it was the Instagram post that got her attention, but she'd actually been hearing from the community that there was a doctor in Carborough that was going to be looking for somebody. And so she was literally like there when the post went up, and within 24 hours we were on the phone talking to each other. And so I thought it was the magic of Instagram, but it was more luck favors the prepared. So
I
But
love that. I love that. And
yeah,
I think that one thought I have is that, and this is harkening back to the Patreon recording that Dr. Julie Gunther did, is that she has chosen to stop practicing as a direct primary care physician, and she's not, thankfully, like in a critical health situation that forced her to do that. You are also in that boat of, you know what? I love lots of things. I love being a great doctor and taking great care of patients. I also love that I have to take care of myself in order to be there for other people and to be there, especially for myself. So I think that just that space to think in the hat of what do I need doesn't come easily when you're in fee for service, when you're getting gaslit, when you're getting passed over by every person who does not have a medical degree, and they get to call the shots as to how you practice. So I think that it is wonderful that you were also in a space, you were prepared in the sense that you had a DPC practice that you could play in this space of what could retirement look like. So one question there though, because when you were thinking about hiring, you were a physician assistant before you became a doctor. So
oh yeah,
and so
long
this
ago in a
is
galaxy far, far away. Yeah.
and I found, like, I did not know that until I was looking into your guys's presence on what I could find on the internet. But I'm just wondering because there is this there are many voices talking about, oh, just hire mid-level, or I can't find a physician, I need to hire mid-level. Did you ever give thought to a non-physician provider joining you as a support person, as another person practicing alongside you with their own panel? What was your thought process in intentionally looking for a doctor versus a non-physician provider?
Yeah, this is a conversation we had not too very long ago, and realized that sort of both it's both funny and incredibly true that our name is Unorthodoc, not Unortho mid-level. And so we're kind of, I went out of my way because my previous practice was carbo pediatrics and internal medicine. I went out of my way with the name of Unorthodoc, not to tie myself or even myself. I didn't put my own name in it. I didn't put a place name in it because I wanted it to have the ability to go anywhere that it wanted to. If we needed to move, if we needed to change, if I needed to leave or whatever, I didn't want Unorthodoc to be impaired by that. But I did realize that putting doc in it did give us a bit of a limitation. But as a physician's assistant, when I was originally a physician's assistant, and things have changed a lot in the way PAs and nurse practitioners are trained, the ways extenders are trained now. I mean, now it's a master's level program, and when I did it, it was a bachelor's level program. But I was trained, it was a wonderful thing in that I was trained to be, the idea at that point was that doctors had terrible bedside manner, especially when they were rushed, and they needed somebody whose job it was to form the relationships and take care of the emotional and connection needs of the patient. So that's what I was hired for. That's what I was trained for. And actually my training in medical terminology and in suturing and in psychology were way better when I was a PA than anything I got during my residency or med school. Because that's what we were designed for. We were designed to literally extend the relationship with the physician so that they could just make decisions and we could make people happy. But that was where I realized, I didn't know it then, but that was the same. I ended up becoming a physician then for the same reason I ended up becoming a direct primary care physician in 2015. I cherish that relationship, and I can't stand doing all the work to create a relationship and then having somebody who is totally uninvolved in the relationship come in and tell us what to do. And I didn't know that. Actually, I did not really realize that until I was filling out the stuff for you, the questions that you asked. Is, oh my God, it was already there. It was already there, what I was ultimately going to do. Let's see, did I answer your question?
Can I jump
tangent,
in? I'm going to jump in too. So I think part of why Dr. Annis looked for a physician initially was because she was not only thinking about someone else to help with clinical care, but she truly was also thinking about a succession plan, right? And she wanted a physician to captained the ship, so to speak, of Unorthodoc. Since then, we've had dialogues because we're looking for a third physician, and it is not easy to find the right person and the right fit. And we have enough demand where, sure, we could bring in a mid-level and we could probably fill their panel. And so we bounced that idea around. But at the end of the day, at least for me, I went to medical school to take care of patients. And that's where my joy is, right? I think that is 100% true for Dr. Annis. I didn't go to medical school to supervise APPs. No offense to APPs, right? That's just not what brings me joy in clinical practice. So I'm not interested in hiring an APP for selfish reasons, because I want to do clinical care. I want to work alongside bright-minded, intelligent fellow physicians, and I'm good.
Being trained as a physician's assistant and then going back to medical school, I have a really unique perspective on the what we know or what we don't know. And as a physician's assistant, I didn't know what I didn't know. I either had to assume I knew nothing or assume that I was pretty damn good at what I did, but I didn't know what I didn't know. And when I went to went to medical school and to residency particularly, it was like, oh my God, there are so many things I don't. There's so much that I don't know, and I will never know. Will never know. I mean, I was dumb enough to double board in internal medicine and pediatrics.
Good luck with that, Corey.
Yeah, good luck with that. I will never know. And there's something about that. There's something about that is beautiful in that it keeps me really humble about my own knowledge base.
And I think this is so important for people to hear, because if you are a listener who is about to graduate residency and you are not aware that in a contract, it can say that this role requires you to supervise a particular number of APPs, like that is a thing. And that is something this podcast celebrates the transparency that we bring as direct primary care physicians, but that is so important for people to be aware of if they're looking through their contract draft before they sign the dotted line, that it takes away time from what your job is as a physician to show up, to be flexible enough to take in the new guidelines on hepatitis B screening, of which there are new guidelines. If you don't know, check it out. And to then just spend the time with the patients. That is our jobs. It's what we went to doctor school for. Never did I have a didactic on how to supervise a non-physician provider. And that is not that should not, in all of our opinion, be part of the job description, but yet it is. And so I think also it's so important to hear your perspective, Dr. Annis, as a person who was a PA and then became a physician, because just like Dr. Jennifer Allen, who was a nurse practitioner before becoming a physician, there is you nailed it. You don't know what you don't know. And there isn't a level of training to become a physician if you are not a physician. So I think that is so important also for people to hear in terms of the thought process of who are we going to bring on, in your case at Unorthodoc. So Dr. Nayo, let me ask you, because the serendipitous relationship was created after Dr. Annis posted and you saw the post, but in terms of your experience transitioning, because you resigned from your prior position and you said that you loved the community, and I'm sure that was one of the driving factors to take another position, is something where you could be a significant part of the health of a community. But you also mentioned how you are the primary breadwinner and you are a mom of multiple children, which is really freaking hard in of itself. But when you were so quickly going into this relationship with Dr. Annis, what drove that swiftness of signing the deal? Because I don't know if in the job description it was mentioning like this is a potential pathway to partnership like you wanted originally.
Yeah, I think there were multiple factors. So I left the independent county health system quite rapidly. I was done on so many levels that I felt ethically compromised. I felt burnt out. I felt unheard. I felt like things weren't safe during the pandemic. So I was done there. I needed to pivot quickly from a financial perspective and was very blessed to find the nocturnist work at a prison. So the financial box was checked and I knew that our family would be able to pay our bills. I will say my joining Corey was done more slowly and carefully in that, because I didn't want to mess it up, right? Like, I really felt that direct primary care was kind of my hope for longevity in primary care and was where I wanted to go ultimately. So Corey and I took it slow. I agree with Dr. Annis's comment that partnership in practice is like a second marriage, right? You have your professional husband and wife, and then you have your personal husband or wife. So we agreed that I would come on as a 1099 general contractor. We kind of did a understanding handshake about the fact that if things went well, Corey would entertain bringing me on as a partner and having me buy into the practice. But we essentially said, okay, Amy, you can 1099 for a year. You're going to find your own patients. If new patients call asking for Dr. Annis, you can have them. And then after a year, we'll evaluate whether it was a good fit and whether we want to stay together. And if we do, then we'll work on figuring out buy-in, which is incredibly complicated. FYI, that took a long time. That part was way harder than like figuring out fit. I think we figured that out confidently in the first year. And we also had a handshake. I think we actually put this on paper that there was no non-compete for me. So if at the end of the first year of contracting, either of us felt like it wasn't a good fit, I could take my direct primary care patients, hang my own shingle, and be on my way. So we took it slowly at the beginning, and I encourage anyone who's exploring partnership with another physician to do the same. It's a big decision.
Totally. And just working with my husband, like my actual husband, who's also a business partner. It's a lot. It's
Bold move, right?
Yeah. So I 110% agree with that statement. Take it seriously, folks, because you do so much that you don't even know that you're going to do as an entrepreneur. You don't know who's going to call and what questions are going to be randomly asked from your community. If you can do this, or if you have a response to a question, you have to develop those things. All of the things that we do as entrepreneurs, it just goes back to Dr. Annis, you being a physician for entrepreneurs, and you understanding as an entrepreneur yourself how crazy busy it can be. So I think that is wonderful that you address the no non-compete. It addressed, for me, when I hear that says to me, I don't have any, it's really hard for me to see that you would want to leave, because this is such an awesome clinic to practice in, and you literally can do what you need to do while not having to worry about starting from the ground up. So I think it speaks a lot to the culture that you had created already, Dr. Annis, that Dr. Nayo joined into. So I want to ask now about your guys's having two people who help in the practice. You have Becky and Jody. Both of them are medical assistants, CMA and MA, if I'm correct on that. How did you guys find Becky and Jody to be able to partner with you guys and to help you focus on what you need to do?
Why don't you tell Jody's story and I'll tell Becky's?
Yes. Well, when I was forming, there was a lot of work that went in before 2015 when we actually opened our doors. And one of the things that the partner who I was starting to separate from let me do is hire a medical assistant that I would take with me. The intention was that I was going to hire and hand train this person, but also, thank God, be able to have this person trained by the other MAs that were in our practice. And they were all really wonderful people. So it's interesting. I had originally hired Jody as a scribe. She was an off-site recording scribe, and she had not done an actual in-person scribing before. She'd been translating dictations for one of the major hospitals right at the end of when they started doing away with transcribers at transcription services. But she'd been running her own transcription service. But so she was listening to my conversations and making notes out of them. And not too many months into it, she said, Dr. Annis, I really want to work for you. I want to come in and I want to be part of your clinic.
Because she was blown away by the quality of care that Dr. Annis provided her patients.
Yeah, she got to listen to me in a way very few people ever do, outside of the patient themselves. So thanks. That was
true.
sweet, but yeah, it was really sweet. And of course I was flattered. At the same time, I was entertaining a resume from a very bright, up and coming, tech savvy young person who had just graduated from GW and loved the idea of unorthodoc and direct primary care and just dying to help me. And so I had Jody's criteria and this gal's criteria in front of me, and I presented it to my husband. And I said, well, here's Jody. She's mother of 3. She is younger than me, but not so young that she's like social media savvy or whatever. And then I've got this girl. And my husband said, hire the mom. And I was really disappointed because I wanted the tech savvy young person to do my tech forward DPC practice, the front face of my DPC practice. He said, no, Corey, you need the young savvy tech person is going to work for you for a little bit, pad her resume and move on. I said, you need a doctor wrangler. You need the mom. She said, I have no doubt the mother of 3, 2 of whom are twins, can keep you in line. And it was incredibly good advice. And yeah, and she keeps the clinic humming. She keeps everything in order. She stays ahead of me. Sometimes she stays behind me, kicking me, chasing me
for orders.
Right. Yeah. Whatever. And I swear to God, many of our patients are part of Unorthodoc because of her, because they love to see her. And she just took to the arena of being face to face with patients like a duck to water. And it makes her happy. And it makes me happy that she feels such meaning in the work that she's doing. And she was born to do it. I mean, when she walked into the office, she didn't know how to give a shot or draw blood or do an EKG. She just knew how to transcribe notes, but she was very familiar with medical terminology, which helped a bunch. So she became the mama bear for Unorthodoc. And then you arrived.
That was in 2015. So Unorthodoc, Jody has been with Unorthodoc since the beginning. So then when I joined, I started with 0 patients and grew very slowly since I was working another full-time job. So I did not have a medical assistant initially, which I actually think overall was a positive thing. I learned how to do all of the MA tasks, but I was blessed because we had Jody in the organization. So when I was like, how do I do a prior authorization? She was like, oh, let me tell you about Cover My Meds. So I learned a lot, right? And then as my panel grew, we knew that we needed to hire an MA. I'll keep the story short, but we hired someone off of Indeed initially who was great, who was young, who was social media savvy, who was tech savvy, who had worked at a front desk of a fee-for-service clinic and was bilingual Spanish, which is something that I really wanted. She was with us for about a year, ended really cordially. We had just had different needs and she had different needs. And then I was blessed again. So Becky, our second MA, was my medical assistant when I worked in rural fee-for-service. And she is amazing. She's been an MA for 20 plus years. We're the dream team. She doesn't know I call her that, but I do.
We're the dream team.
I know. We're all the dream team. Essentially, I was a young physician, first attending job, and there is nothing like being paired with a medical assistant who has seen and done it all. She had done rural pediatrics, rural OBGYN, rural primary care. So she just kind of knew what I needed before I knew I needed it and would hand me things as we did procedures, that kind of thing. So anyway, I had I don't know what you call it, but I wasn't allowed to hire employees from my prior practice for 2 years. So the timing worked out perfectly that when my first MA left, I was able to make a job offer and she was on the market looking for something different. So we have 2 fabulous MAs. They do everything for us. They room patients for us. They do our prior auths. They collect fees. We're currently thinking about whether to add a virtual assistant to our team to pick up some of the back of the office work and just increase our consistency with some of our work flows. We're not quite there yet, but that's how Unorthodoc is staffed currently. 4 fabulous women.
I love it. I love it. And tell me about how, in terms of the hours that they work, the benefits that they get from, if it's retirement benefits, 401k, or if it's just, like that they get their direct primary care practice membership paid for, whatever it is. But how do you guys, what, I guess, do you have any perks for them as your dream team members?
I'll take this one.
Yes.
Yes, we do offer benefits at Unorthodoc if anyone's looking. So in all seriousness, we've kind of built our benefits over time. But when I wanted to hire Becky last year, health insurance was an absolute must for her. And it really pushed us in a good way to be like, if we're going to attract the best and the brightest and keep them, we need to offer a living wage and have great benefits, right? Corey and I have dealt with our insurance outside of Unorthodoc. I get mine through my husband.
I'm on Medicare.
Awesome. So as of last year, we offer a full health insurance package, which we pay a lot for, but our MAs need that. We're adding a retirement package actually this quarter. So we're really excited about that. We try to pay a competitive wage. I think we have to invest in our team if we want longevity and continuity and to truly make the best hires. So I feel really strongly about that.
Mm-hmm. The other thing that I think is really attractive about working with us, whether it's physicians or the MAs, is that we have built in a tremendous amount of flexibility in terms of scheduling. And the schedules can be very demanding, but we let Becky and Jody decide, let them dovetail. How are they going to dovetail? Who's going to take care of who on what day, and what other needs do they need to meet? And it's lovely to see the two of them just work it out.
They are about 50-50. So they're about 50% in the office, in person, rooming patients with us and doing all of the in-person tasks, and 50% working remotely from home, doing the fax box, all of that. And we trust them to be motivated adults who can figure out their schedule as long as someone is staffing us in the office when we need them.
Mm-hmm.
Fantastic. Now, I want to ask about locations, because Unorthodoc started in Carborough, and then closer to Dr. Nayo's home is Durham. And so you guys opened a second branch of Unorthodoc in Durham. How was that process? Because definitely people, especially as more patients are joining on, it sometimes can make it easier to find a physician if they're able to open another branch in the place that they live already.
I'll start that one too. Is that
well, no,
okay?
I do have to say something here.
Go, Corey.
First of all, I think maybe it was our second date when she said, we will open an office in Durham someday. Yeah.
Setting expectations.
Yes, right. Exactly. No, that is one thing that I really appreciated about the way Amy came to the job, is she was really clear about her expectations. And it was like, I hadn't put a whole lot of energy into branching out because there was just me. But truthfully, from the very beginning, I have to admit, world domination was on my mind. So, I mean, it's a really cool name after all, deserved to be spread. But when she said she wanted to do something in Durham, I'm like, okay, well, let's just work in that direction and see what happens. Let's see if we get to the partnering phase and whatever. But yeah, you were very clear about that. And I took it as a good sign. It took, first of all, initiative. That's what I have looked for with anyone who's ever worked for me, is do they take their own initiative or do they self-start? And I was like, she had self-start in spades.
Yeah. So my husband and I have 4 kids between us. I grew up inner city without a car. I don't like commuting. I like listening to podcasts, including yours, in the car, but I don't like commuting. So I knew that I wanted to have a Durham location. Dr. Annis was in Carborough for historical reasons because she owned a building there and her prior practice was there and she already had a patient footprint there. And I had no problem starting there and continuing to work in Carborough. But I knew Durham was my ultimate goal, at least half of my clinical time per week. It was hard figuring it out. And you'll love this story because this, I think, to me, epitomizes how collegial and enthusiastic and welcoming the direct primary care community is. So we essentially wanted a part-time space in Durham initially as we started to open our Durham location. And I just couldn't stomach these long commercial leases and that you have to pay to fix it up. Like, this is all nonsense. I'm not doing any of that. So I started looking around for a sublet in another clinic and found some options, but wasn't super thrilled with any of them. So I I went to my personal direct primary care doctor who takes care of my family, who is biking distance from my house, and said, would it be weird if I sublet from you? Would that be like competition, or is there a non-compete between us? I don't know. And not surprisingly, because Dr. Tanisha Bolden, who is amazing and is a direct primary care physician in her heart of hearts, was like, that sounds great. You want to rent a room for me? When do you want to start? So we sublet a clinic room from another local direct primary care doctor 2 days a week. We just increased our footprint there to 2 days a week. It's logistically challenging. Happy to go into that further, but important for me and my quality of life. So the beauty of DPC is you can do whatever you want with it.
Yeah. Well, and the kicker here is that we actually live about 3 miles apart from one another. I bought my first house in Durham and could not duplicate that house anywhere else in this area for the same price. And so I stayed, even though I was attracted to Carborough to start the work, the beginning of my career. So I've commuted 35 minutes each way my entire practicing career.
I'm going to have her see patients part-time before she retires in Durham, so she doesn't have to commute.
Yeah. Oh my gosh. That's, for those of you who have commuted, it's like, some of you might be saying like, that's nothing. Like that's amazing. But it totally is a drain. Like Dr. Nayo, when you talk about where you grew up and you didn't rely on having a car to get you places, I grew up in Sacramento where I knew exactly like where the line was on my Volkswagen Beetle, that I still had 12 miles of gas, even though it said I was empty. And I knew exactly time between home and high school. But here I complain about it's 2 minutes to drive to my clinic, and our highway, like our one direction each way situation that we have in Arnold, California. But it's really hard to unsee how awesome it is to practice close to home. So definitely something to think about for those people who are looking at location for growth or looking for location to open. Location definitely matters. Again, it's just you're able to really focus on what you need to do, and that does not include having to gas up the car and drive places if you don't have to. So I totally hope that as your career as a family physician at Unorthodoc is finding an endpoint, that you are able to practice even closer to home. So you get that too, Dr. Annis.
Me too.
So,
And I think it makes us better direct primary care doctors to practice close to home. I like doing procedures. If someone after hours has a laceration and needs a tetanus, like I might think about doing that if it's 5 minutes from my house. I'm not going to do an hour round trip, right? So I think my patients will actually have better access to me in a way that fits in with my quality of life at home.
Mm-hmm.
Love that. And now, as you guys have talked about the practice, how you guys have come together to continue this practice as physicians with Becky and Jody, who are you taking care of at Unorthodoc?
Well, in the first year that Unorthodoc was open, I got my help. My mentor was Dr. Brian Forrest, who opened a few years before me, and when DPC really didn't have a name at all. And he made a statement once about how in his waiting room one morning, he had a guy who was actually living in a homeless shelter who had gotten there on a bus, sitting across from a guy who had driven up in his Cadillac Escalade or whatever. And that they were both there because they valued the quality of attention that they got. And it wasn't very long after starting Unorthodoc that I had essentially the same experience. But I would say that we're heavy on either people who work for small businesses or small business owners. We don't have a lot of academics, and because we're 10 seconds from UNC and 20 seconds from Duke, we have a lot of doctors and healthcare providers as well. But what Amy noticed the minute she started seeing patients there was that the health literacy was real different in Carborough. And that seems to be true regardless of socioeconomic status. But yeah, I mean, I'm very proud of the fact that we've kept the price point at a place where hairdressers and financiers come to the same practice.
Yeah, this is a great question. As a family doctor who's always done underserved care and really has a passion for that, I'm a Peace Corps background. I worked with homeless in Chicago when I came back from Peace Corps. I've worked with refugees. I've worked in an FQHC setting. I've worked in a rural setting. That is where my heart is. And so concierge was an absolute no-go for me. And I was worried about who am I going to be caring for in direct primary care. But Dr. Annis is totally right. We take care of all comers. I've got refugees, I've got immigrants. We landed a great small business. It's a fairly large cooperative grocery store in our area. So it's all, I call them eclectic, very diverse mix of people who work for this co-op grocery store. I love them. So yeah, we have people who can barely afford our $75 a month and who
look at it as an investment in their health.
Yeah. And if we need to float them for a month or two here or there, because it's hard, we do. And then we've got people who are like, you don't charge enough. We need to pay you more. And we have great diversity. Now, is there room for improvement? Sure. Do I think our Durham footprint will bring in a different patient population that I'm really excited about? Yes.
Yeah. And in Dr. Annis's retirement future, quote, retirement, we're working with all different kinds of ideas about what unorthodox looks like next. Can we create something that expands even further the kinds of patients we take care of? Can we do a nonprofit? Can there be a nonprofit arm of Unorthodoc? Can we do a benefactor practice? In what ways can we take this model and stretch it? And so when I say I retire, I always feel like I put air quotes around it, because it's, no, I need some time. I need some protected time to see what Unorthodox future is going to evolve into.
And that's exactly what I wanted to ask in terms of what does the future look like? Because I think that, again, you hit the nail on the head. When it comes to retiring as physicians, we're so active and creative, especially those of us who choose to go into direct primary care and open a business from nothing, that it's really hard. I mean, we hear it, all of us who see adults all the time. Oh, I retired. And I'm like, I'm struggling because I'm actually like not dead. I actually have a lot to be able to give back to my community still. I'm just trying to find a way to do that. And I think that again, just like the pioneership that you showed doing this when it didn't necessarily have a name to it, when it wasn't where it is today, speaks a lot to that you may retire from taking care of patients on the day-to-day, but you're still able to continue enhancing the relationships that you guys have built at Unorthodoc, no matter what you choose to do after. So I think that that's awesome. And in terms of, you guys have also touched on what the footprint will be in Durham. Dr. Nayo, do you have any comments as to what you want to see in the future going forward as you're looking to get more patients in Durham, expanding and having another physician join you?
I think there are so many options, it's overwhelming. So we're currently in the phase of deciding what we're most committed to and moving forward with that. I would like to see patients more than 50% of the time. But one day I would like to be doing some more macro work around direct primary care, whether that's an expansion of Unorthodoc, either in a for-profit or a nonprofit model. I would for sure like to hire another physician because having partnership in terms of clinical practice is important to me. I want to make sure that Dr. Annis has an exciting runway to retirement that uses her macro thinking skill set for the good of direct primary care. So we're currently in that kind of listing all of the things that we could do and honing in on what's most important. When you work in DPC, you sort of feel like the world is my oyster, but you also really want to protect that time with my family, time to take care of myself. So working to prioritize is really important.
Yeah, it is. If I had stayed in the fee-for-service world, as much as I loved it, as much as I loved the practice that we built, I would have probably either died or I would have retired quickly and probably with a bit of bitterness and not really known what to do with myself, because leaving that, I certainly can't fix that. But moving into direct primary care, it made me 10 years younger, 15 years younger. I mean, I'm 67. I feel like I'm 47. When I'm working with DPC, I'm yes, the world's our oyster. Everything's possible, because the things that the DPC movement has already achieved at one point looked impossible. And now it's, well, hey, now, I mean, it's becoming the standard. One of my biggest dreams that I hope that I want to, with Unorthodoc, I wanted to create something that was bigger than me and would last longer than me. And I have this hope that what we're doing is we're helping patients raise the bar for what they demand from healthcare. That whether or not we actually storm the bastions and tear the system down, if we're giving people a whole new definition of what care looks like, and our patients are giving us this whole new definition of what it is to be valued and validated as a primary care physician, that virtuous cycle, I'm hoping, ultimately reaches the system and says, no, we want better. This stinks. We want better. And what a terrific legacy. So that's what that's where I see my retirement going, is trying to figure out how to maximize this experience for the greatest number of not only patients, but my colleagues, my physician colleagues. And I can't think of anything more fun to be doing in my quote retirement, my so-called retirement.
Well, I love it. And that is today's episode, everybody. We are going to have an awesome conversation about sustainability as business partners with your staff, what to look for in terms of what is going right and how to sustain that in the future, and how to be sustainable as entrepreneurs and physicians. So it has been such an honor. Please join us for that conversation over on our Patreon community. Dr. Annis and Dr. Nayo, thank you so much for joining us today.
Thank you, Marielle. It's been fun.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.